So it's the holiday season. Physicians, I know you're thinking about this. You're kind of wondering where you are in life, if you're happy with where you are, if you're happy with where you're going. You're kind of thinking about the future and what does your career hold for you? Many of you are looking for more variety. You're either sick of what you're doing, or let's be honest, maybe you're sick of the people you're with, or where you work, or the hours, or the call. Maybe you want to see the more of the country, or see the world even. And you still love medicine. You still want to take care of patients, but you're just not happy with where you are and what you're doing. And you might feel trapped. And it's easy to feel trapped because you've put so much hard work into getting to where you are today. I mean, think about all the work you had to do for high school and college and medical school and residency and all those extracurriculars you had to do. You now have this MD after your name, but despite all that, you're not happy with where you are and what you're doing. And so, it turns out that one easy solution to this that a lot of people are starting to think about now, which can make your job so much more fun, plus give you the option to see the country or even see the world, is locum tenens. Now, people ask me about locum tenens all the time. Dr. Greg Charlop here. I work with physicians and groups that are looking to keep doctors happy and find a better way of making a work-life balance for doctors. And the way locum tenens works is they're almost like headhunters for doctors. And the way it works is there are different medical groups or hospitals or even solo offices that need extra help. It's usually temporary. And maybe people are going out on vacation, or someone's out on maternity leave, or maybe business picked up and they need some extra coverage until they can get themselves staffed up. And so what they do is they look for qualified doctors like you who could come and fill in this role. Now, sometimes these positions can be full-time. You work full-time for a certain period of time, maybe a few weeks or a few months. Sometimes it's more flexible where you can go and you go to these places and you work for a few days a week or a few days a month or a few hours here and there. But the beauty of it is it gives you this incredible amount of flexibility as a doctor. So it lets you work somewhere else, and it could be across the state, across the country. The locum firms typically pay for your travel. They pay for your lodging. If you're staying at a hotel, they pay for that typically. If you have to fly somewhere else to work, they pay for your travel, which is awesome. They pay for malpractice. So even those of you who either have a restrictive malpractice policy or maybe don't have malpractice coverage because it's provided through your former employer, you can often get malpractice coverage with a tail through the locums firms, which is awesome. And another thing that's pretty neat is they will actually help you, in certain cases, even get licenses in other states. So, for example, say you live in Colorado, you've always wanted to see what it's like to work in California, and there's a spot in California, and they're having trouble filling it for whatever reason. They may help you get a California license and the malpractice policy you need to come and work in this spot in California, as long as usually you have to work a certain minimum amount of time, to make it worth their while. But they help you get the license, they do the paperwork, they typically pay for it. So it's awesome because it gives you, as a doctor, this just unbelievable flexibility. Now, I think that there's a lot of other benefits to the doctor for doing this. And one of them is you get exposed to different practice settings. Now, I'll tell you, I've worked at a lot of places. I've done a lot of locum tenens work myself. And so I feel like it's made me a better clinician. And the reason is that I see how different places do things. If you're just at one place for a long time, one hospital or one medical group or whatever for a long time, you tend to think that one way is the way it's done. Everybody uses the same equipment, everybody has the same protocols, and the frustrations and stuff that you see every day, that's just how it is everywhere. But when you go to these other places, you realize that each place has their own way of doing things. And you'll see for yourself that, some things work pretty well, other things don't. And by gathering this exposure, by gathering this experience with different places, you learn how to be better at your craft, how to be better practicing medicine, because you're able to take the best of everywhere and kind of get rid of the stuff that doesn't work, which is pretty neat. Now, another big one, and I think this is huge, is I believe that locum tenens is a great way of combating physician burnout. So many of us are looking at leaving medicine altogether because we're fed up with what we're doing. Maybe there's bureaucratic overreach at our hospital. Maybe we're doing things that we don't philosophically agree with, that are imposed on us or that are just due to circumstance. Maybe we're working too much, or we're bored, or we just don't get along with the people we're with and we just feel burnt out from it. Some of us watching this, some of you may be thinking, well, maybe I just should leave medicine altogether. But I'm telling you, your interest in medicine may be rekindled simply by trying to go somewhere else and working with other folks, other groups of people, other places, other environments, other sets of patients, even other equipment. I mean, even something, I'm an anesthesiologist, even something as simple as going from an operating room which doesn't have any natural light to somewhere else where the operating room does have natural light. Even something, that seemingly basic can have a big impact on how you feel. And so locum tenens is a great way to do that. So I encourage it when I consult with physicians who are struggling with burnout or leaving medicine altogether. I often recommend considering locum tenens because it's just such a great option. If you have more questions about this, feel free to reach out to me, Dr. Greg Charlop. And I wrote a book you can get. You can get a paperback, Kindle, audiobook called The Physician Wellness Project. Look it up. It's on Amazon. It's on Barnes & Noble. It's everywhere. Walmart. Wherever you look for books, it's there. Audible. So check it out. If you have any questions, reach out to me. And happy holidays.